Hello everyone, I'm Jane, and this is the CareSmartz360 Bulletin. Hello everyone. We're monitoring health policy developments that affect millions of Americans at home. A new national poll raises sharp questions about proposed changes to Medicare home health funding. A national poll commissioned by the National Alliance for Care at Home finds that 7 in 10 Americans oppose the Centers for Medicare and Medicaid Services proposed 2026 Medicare home health rule. If enacted, the rule would trim Medicare home health funding by about 9% next year, an estimated $1.1 billion. The poll shows broad cross-party opposition. Voters indicate that targeted measures to curb fraud in the system would be preferable to across-the-board cuts. Supporters of the alliance argue that home health care is not only essential for patient safety and independence, but also saves taxpayers money by reducing avoidable hospital and emergency room visits. They say cutting funding could jeopardize access for seniors and people with disabilities who rely on home-based care. The poll finds strong consensus that home care helps control costs and keeps patients out of higher-cost settings. 71% view home care as the most affordable option, compared with 17% for hospital care. Notably, a majority also backs steps to reverse or mitigate the cuts and to crack down on fraud in the home health system. Tony Fabrizio, chief pollster at Fabrizio Ward, says voters see the logic, protect effective programs, target fraud, and avoid broad cuts that harm patients and legitimate providers. The National Alliance for Care at Home is urging Congress and CMS not to finalize the proposed payment cuts. They advocate revising the approach to strengthen access to home-based care while addressing fraud more effectively. We'll continue to follow this story as lawmakers weigh responses to the poll and consider reforms to the home health program. For now, the public sentiment leans toward preserving access to home-based care and focusing on targeted solutions rather than sweeping reductions. That's all for today in the CareSmartz360 Bulletin. See you soon. Until then, have a great day.